I'm joined by Professor Shabir A Madhi. He, of course, is one of South Africa's most prominent vaccinologists. Thank you for joining us from Johannesburg tonight. I'm also joined by Dr. Sudharshan Ballal, of course, a well-known Karnataka medical experts, doctor and a member of the Karnataka Covid task force. Dr. Ballal, I'll go across to you first because of the two cases being reported from Karnataka. One, of course, has already left Karnataka. Now, there's some good news coming out of this, that they were both fully vaccinated and the symptoms were extremely mild, or in one case, the South African national, there were virtually no symptoms. So, do you feel that Omicron is perhaps not as worrying as we once thought, or these are early days yet?
Good evening and thank you for having me here. As you rightly pointed out, I think it's a new variant, so we do not have enough information. From whatever we know, it is extremely infectious, far more infectious than the Delta variant. And so far what we have seen is it's an extremely mild disease. We have rarely seen any hospitalization, ICU requirement or mortality. So that is sort of the silver lining. The only variable that we are still not fully aware of is whether it escapes the immune phenomena of the current vaccinations. I'm not surprised it has come to India. I would be surprised if it hadn't come to India. We are a population of 1.3 billion and the world is now a small village. So if it spread to other countries, it was but obvious that would come to us. However, what is important to realize is that the prevention of spread of COVID is the same, whatever be the variant.
Yes.
First is the public health measures, intense surveillance, including a genomic analysis of the samples that are needed, masking, social distancing, hand washing, and of course, the important tool now we have is vaccination. So we should aggressively pursue vaccination in addition to implementing strict COVID-appropriate behavior. Right. That's the only way out. Certainly no panic.
Absolutely. And if I can bring in Professor Madhi here, because South Africa is really, I think, the cases and the rate of hospitalization is being watched by the world. But of course, we now know that the cases could have been first in the Netherlands. And interestingly, one of the cases here is a 46-year-old Indian doctor who hasn't even traveled abroad. So what are you seeing, doctor, as you're watching the Omicron being reported from across the world? Do you now feel that this is not something we need to observe as some kind of South African case study, but we need to be looking globally at all the data that's coming in? And what are you finding, since you, of course, you are the Director of Vaccine and Infection Diseases Analytics, what do you find as the key features now of this variant?
So thank you for having me. So I think you're completely correct. The variant most likely did originate in Southern Africa. And that's the reason why we are identifying so many cases currently in Southern Africa. And it's not 200 or 300 cases. We need to remember that even in a country such as India, as is the case for South Africa and globally, it's only a small percentage of people that are infected that even come forward to be diagnosed and to be investigated. In addition to which, of all of the people that are infected, we're only doing sequencing on a fraction of all of the positive cases. So right now in India, if you've already got 2 cases, including one doctor as an example has been infected without a travel history, you can be rest assured there's probably thousands of other cases in India as there is in South Africa. And that goes for any other country where the virus has already been identified, and particularly in the absence of individuals having a travel history to Southern Africa. So it's a completely futile exercise to lock your country to have a travel ban on a small group of countries, yet allow people from other countries to travel to your country who are still allowed to travel to South Africa. So it's just a matter of time before we see a further dispersion of this particular variant. When it comes to the severity of illness, the experience in South Africa is that most of the illness is mild. And I think similar to India, it's not only about vaccines, there's another dimension to this. And that is right now in South Africa with the Sero survey, looking at how much past infection has taken place. Close to 3/4 of the population have been infected during the course of the first 3 waves. And there's similar sort of data from India. And that past infection doesn't really protect too well against reinfection, but it protects quite well when it comes to preventing infection progressing to severe disease. So right now, this variant is evolving at a space of time in low and middle income countries where the substantial amount of immunity has been built up, at least against severe disease. So we will see large number of cases, including of reinfections taking place, including breakthrough infections because in people that are vaccinated, but not severe disease.
So that's an interesting question. Even in India, we saw, even though our vaccinations have crossed 49% today, I think South Africa is lower than that, of course. But the previous infection was a major issue in our second wave with the Delta variant. So that perhaps will give us protection. Let's see. But Professor Madhi, the point that we just took a graphic of how much South Africa cases are going up. So pointing perhaps to the transmissibility of the Omicron variant. But what is the impact on hospitalizations? Because that, of course, is the big worry for the globe around, that the infection may be one thing, the number of cases, but hospitalizations and deaths is really what we don't want to see, a repeat of the Delta variant.
Absolutely. And I think these sort of figures that you're just showing right now are somewhat depressing and can cause panic. And what you're saying is exactly true, that we're seeing a massive surge of cases, and especially in the one province where this particular outbreak initially started. But when looking at hospitalization in the same province, we're not seeing as rapid an increase in hospitalizations compared to what we had seen during the course of the first 3 waves. So the hospitalization rate is increasing and probably will lag behind by about 2 to 3 weeks compared to the cases that are occurring in the community. But the rate of increase in hospitalization is slower than the rate of increase in infections, which right now seems to be greater than what we experienced during the course of the first 3 waves. And it speaks to the issue of the unhinging of infections and hospitalization and death.
In fact, I'd like to bring in Dr. Ballal on that, because Dr. Ballal, India is, of course, in a good spot right now in the fact that our cases are now the lowest in the last 18 months. Our vaccinations, we've crossed 125 crores. We've crossed 49% fully vaccinated. But this worry that the doctor in Karnataka, a healthcare worker, had no travel history, no foreign contacts. Do you feel that we must now be looking at booster shots perhaps for healthcare workers, definitely frontline workers? And the second, that Omicron may well be in the local population now?
I think both the things that you mentioned are true. I do believe we cannot rule out a local infection. We still need to have more data. We've just seen this doctor with no travel history, no previous contact test positive. It will be interesting to see what is primary and secondary contacts who are positive, whether they also have the Omicron variety or something else. So I think we still need some data, and I'm sure the public health officials will give us more data on that. The question of a booster dose, I think vaccination is the key as of now, still, to sort of prevent serious disease and mortality in all forms of COVID. Hence, I do believe that the first dose should be given to anyone who's not received it, second dose to the people who received the first dose, and certainly a third dose or a booster for the people at high risk. And India has demonstrated that we have done quite well. We have managed COVID reasonably well so far. And fortunately for us, there is enough vaccines available. We have great infrastructure. We have vaccinated up to 2.5 crore people in a single day. So I don't see any reason that all three of these can go parallelly, not at the cost of each other. I certainly feel the first and second dose should be priority, and the third dose to the high risk should be offered at the earliest.